My name is Dan LaForest, and I'm a wealth advisor here at Security Financial Management. And today we're going to help you navigate the Medicare maze. So, one of the toughest things for a lot of people is to understand Medicare and how it works while you're working and possibly when you're stopped working. So, our job today is to help you navigate that Medicare maze. There's Medicare penalties, Medicare deadlines. There's Part A, Part B, Part C, and Part D. What does this all mean? And we're going to understand that a little bit better today. So with Original Medicare, this is the red, white, and blue card you're going to get at age 65. You must be age 65 to qualify, or through a disability, you can get it earlier than age 65. If you have end-stage renal failure, permanent kidney failure, or ALS, you must be a citizen of the United States or a permanent resident for at least 5 years. And you must have 40 credits paid into the system over 10 years to have a zero premium for Part A. And it's very important to understand the two different parts of Medicare. You have Part A, which is your hospitalization, and you also have Part B, which are doctors and outpatient services. And we'll learn more about that. But the nice thing about Original Medicare is I can go to any doctor, any hospital in the United States accepts Medicare. There are no networks. So let's understand Part A. Part A, again, is hospital coverage. It's going to cover the hospital stays and inpatient care. It's going to cover hospice care, home health care, skilled nursing care in some cases. And Medicare is going to pick up 100% of those bills after the deductible. And you're going to learn the numbers here later on. Part B is the second part of Medicare, and that's optional when you turn 65. We're going to explain that as well. Just know that Part B covers doctors in or out of the hospital, as well as medical and necessary treatment, preventive care, and medical equipment. Now, Medicare pays 80% of those bills after the deductible. So it's going to leave you with the deductible of Part A, the deductible of Part B, and 20% of unlimited if I just have that red, white, and blue card. Now, there are four different enrollment periods in which you can enroll into Medicare. When you turn 65, you have the IEP, or initial enrollment period. That is 3 months before to 3 months after the month of your 65th birthday, and we'll talk about that a little bit more here later on. You have your annual election period. That is for everybody who's on Medicare. You get the opportunity to make a change in your plan for the following year. That runs October 15th through December 17th every year. Now, you also have the open enrollment period, and that is for Medicare Advantage enrollees to switch plans or return back to Original Medicare. And then you have an SEP, that special election period. And that can be used for a number of different things. One could be dropping group insurance, your employer insurance. One could be moving outside the service area for what the plan covers. Just know that we're here to help you understand every aspect of Medicare. So let's again get back to that initial enrollment period. If you're 65 and have no other credible coverage, then this is the time for you to get both Medicare Part A and Part B. Now, we recommend that you start 3 months prior to the month of your 65th birthday so that you can contact Social Security. You can get your Medicare A and B effective for that first day of the month. So if my birthday is July 2nd, then I am Medicare eligible on July 1st. Therefore, I want to look at June, May, April. Starting April 1, I can contact Social Security to have my Medicare Part A and Part B effective for July 1st. In the event I don't get it done on the 1st, I still have 3 months after to avoid any penalties. So let's talk about Medicare and employer insurance. First of all, in most cases, you do not have to enroll in Medicare Part B if you're covered under your or your spouse's work benefits. Part B is duplicating process. If you have an employer coverage, most likely enrolling in Part A will work secondary as your secondary coverage to your employer insurance, okay? Now, you'll use that Part A deductible that you'll learn about as your deductible. So if I have a $5,000 deductible on my employer insurance and my Medicare deductible is lower, when I'm admitted to the hospital, I get to use that Medicare deductible. If you have a health savings account, you may not want to take Medicare Part A, or you'll lose your tax deduction for that. And you will not be penalized for enrolling at a later date. So again, if I'm going to continue to work past 65, I don't have to enroll in either part, and I will not be penalized. It's only if I do not have credible coverage that I'll be penalized for not enrolling in Part A or Part B of Medicare. So let's talk about those penalties. Medicare Part B penalties. And again, Part B is the doctor insurance, the outpatient insurance. For each 12-month period you delay enrollment in Medicare Part B, you will have to pay 10% Part B premium penalty unless you have insurance based on yours or your spouse's current work benefit. In most cases, you'll have to pay that penalty every month for as long as you have Medicare. If you are enrolled in Medicare because of a disability and currently paying premium penalties, once you turn 65, you will no longer have to make that premium penalty. How do I calculate that premium, that penalty premium? Let's say you delay enrollment in Medicare B for 7 years and you did not have employer insurance, which means you had to delay enrollment. Your monthly premium would be 70% higher for as long as you have Medicare. 7 years times 10%. Since the base Part B premium in 2023 is $164.90, your monthly premium for that penalty would be $280.33. And again, taking a look at $164.90 times 0.7 plus $164.90. Note, although your Medicare Part B premium is based on your income, your penalty is calculated based on the base Part B premium. The penalty is then added to your actual premium amount. So Medicare Part D also have penalties, and most likely this is the most common time where this can happen, is somebody may delay or not take Part B when they're first eligible outside of having that group insurance. And they may decide, oh, I don't need to pay that penalty. I don't take any medications, and they decide to pick it up later. Well, this is what happens. Medicare will calculate the penalty by multiplying 1% of the national base beneficiary premium. Now, in 2023, that's $32.74, times the number of full uncovered months you did not have Part D or credible coverage. The monthly premium is rounded to the next 10 cents and added to your monthly Part D premium. So the national base premium may change every year, so can your penalty amount. The late enrollment penalty is an amount that's deducted or permanently added to your Medicare drug coverage, Part B or Part D premium. So you have to pay a late enrollment penalty if at any time after initial enrollment period is over. There is a period of 63 days more in a row that you do not have Medicare drug coverage or other credible prescription drug coverage. You generally have to pay the penalty for as long as you have Medicare drug coverage. So that stays with you the entire time you're alive. Now, here's a great example. Mrs. Martinez has Medicare, and her first chance to get Medicare drug coverage during her initial enrollment period when she turned 65 ended on July 31st, 2020. She doesn't have prescription drug coverage from any other source. She didn't join a Medicare drug plan by July 31st, 2020, and instead joined during the open enrollment period that ended on December 7th, 2022. So her Medicare drug coverage started January 1st, 2023. Now, since Mrs. Martinez was without credible prescription drug coverage from August 2020 to December 2022, her penalty in 2023 is 29%. So it's 1% for each of the 29 months of $32.74. The national base premium for 2023, or $9.49 each month, since the monthly penalty is always rounded to the next 10 cents. She will pay $9.50 each month in addition to her plan's monthly premium. So here's the math. 29% penalty, 0.29 times $32.74, which is the 2023 base beneficiary premium, is equal to $9.49. $9.49 rounded to the next 10 cents is $9.50. $9.50 is what Mrs. Martinez monthly late enrollment penalty for 2023 would be, in addition to the premium of her Part D plan. So now let's talk about Part A. When we go into, we have just original Medicare, okay? Part A is your hospital. You're admitted into the hospital. Remember, Part A covers the room, the bed, the nurses, the Jell-O pudding, the $20 Tylenol, right? You go in, you have a deductible, days 1 through 60. That opens up that 60-day window. It's $1,600 in 2022 or 2023, plus the 20% of doctors and outpatient services, plus 15% excess charges, which are what doctors can charge above and beyond what Medicare allows. If you're in there for longer than 60 days, then you have an additional amount of $400 per day and so on. So you can see that at the end of the day, Part A, you have the deductible of $1,600. Okay. And if you're longer than 60 days, we'll talk about that individually. So let's talk about Part B. Part B has a premium. We talked about earlier in this demonstration that Part A for most people, for 99% of people, is zero premium. It's that tax you've paid out of your paycheck all your life, right? That Medicare tax. But Part B, when you do activate your Part B, has a monthly premium. And it's based on your income. Now, if you are single, it's based on your individual filing. If you are married, then you have a joint tax return, but it's based on 2 years prior. So for 2023, it's going to be based on your income from 2021. So if you make $97,000 or less as an individual, or $194,000 or less as a married couple, then each of you will have a premium of $164.90 a month. And that's paid one of three ways. If you're taking Social Security, it comes right out of your check. If you're delaying Social Security, you're not going to take that benefit for a later date. You'll write a check to the government for that quarter, or you may qualify for assistance. But it will be paid no matter what option you take. And as you can see, if your income is higher, there's an additional amount. It's called the income-related monthly adjustment amount. So if you made between $194,000 and $246,000, you'll add $65.90 to that $164.90. Therefore, your premium would be $230.80. Now, keep in mind, this is individual. There is no group Medicare. One person has Medicare, another has another Medicare, and you can make different choices based on your needs. So let's understand Part D. In a lot of cases, Part D is one of the most difficult things to understand. Now, D stands for drugs. Now, even though Part D is a federal program, it's insured by a private insurance company. So understanding Part D is very critical because it's the medications now that we have to account for. So understanding Part D and the purchase from government contracted carriers, the insurance company, average premium for 2023 is $34.50. So when we add medications, we have to understand how it's broken down. There's 4 different stages. You have the deductible stage. And if your plan has a deductible, you must pay that out of pocket before you get a benefit stage. And that's the copay stage, stage 2. So what happens now is I have a copay for my medications until I hit $4,660 in 2023 in drug cost. So let's just talk about that for a minute. Let's say that I have a medication and it's a $45 copay that I have to pay. I have that copay after the deductible's been met and until the total drug cost for the year hits $4,660. So if my copay is $45, maybe that drug cost is $200. It's the $200 that goes toward that $4,660, not the $45 copay. Once I hit $4,660 for the calendar year, I hit what is called the infamous donut hole or the coverage gap. And that's when you're going to pay 25% of the drug cost until you have paid $7,400 out of pocket for your drugs. And then you hit catastrophic and you're basically going to pay 5%. So there's some terms you have to understand when you're talking about Medicare Part D and that drug coverage. One is the deductible. We talked about that. That is what you have to pay before you start receiving benefits. The copay, that is your cost during the initial enrollment, the initial coverage state. The formulary, that is the list of drugs that's covered under your plan. Now, one thing to keep in mind is Medicare formularies do not cover every medication under the sun. It's going to cover the most commonly used. Coverage gap, known as the donut hole, you're going to have a shared cost. We talked about that. You're most likely going to pay 25%. Catastrophic, share cost when you come out of the coverage gap. Remember, that's that 5% cost you're going to be responsible for after $7,400. Now, quantity limits. Some drugs have quantity limits where the plan will cover only a certain amount of a drug, a certain number. for a one copay or over a certain number of days. Those limits are set to make sure that a safe and effective use of that drug. If your doctor prescribes more or thinks the limit is not right for your situation, you and the doctor can ask the plan to cover an additional quantity. A tiered formulary. Now, we were talking about that initial coverage stage, and many plans use tiered formularies to cover their drugs. For example, a tier 1 drug is a preferred generic drug. A tier 2 is generic drugs. Tier 3 are preferred brand name drugs. Tier 4 are non-preferred drugs, and tier 5s are specialty drugs. Now, typically, if there is a drug that's not covered under the formulary, you can get an exception and get it covered. And depending on what plan it is, you may pay a percentage of that drug cost. Now, step therapy is an important term to understand because in some cases you may be prescribed a medication, but the generic equivalent is covered by the plan. That is step therapy. One way to help save money on your prescriptions is offering low-cost drugs that can treat the same medical condition as a current brand name drug. Prior authorization, the plan will cover certain drugs, but it may need more information from your doctor to make sure that the drug is being used correctly for a medical condition covered by Medicare. You may be required to try another drug before the plan will cover that prescription drug. Asking for an exception. If you need a drug that's not covered by your plan, you may ask the plan to cover your drug even though it's not on that drug list, that formulary. This is known as a formulary exception. You may ask to waive coverage restrictions or limits on your drug. That's called a utilization exception. Now, coverage decisions, if your doctor has submitted that request on your behalf, generally the plan will make a decision within 72 hours. You can request an expedite for fast decision if you or your doctor believe that your health requires it. So just like Part B, Part D also has elevated premiums based on your income. So again, looking back 2 years at the 2023 premiums, your filing status of 2021, if you made as a joint couple $194,000 or less, you have no additional premium added to your Part D premium. So if my Part D premium is $25 for the plan, then it's just $25. But and again, this is individual tax return and group or joint tax return. If we made between 194 and 246, we would add an additional $12.20 to our $25 drug plan, and so on. So we covered original Medicare. We talked about original Medicare. I can, you got Part A and Part B. If I just have original Medicare, then I have a deductible for Part A, I have a deductible for Part B, and I have 20% of unlimited. So this is where we start to understand what are our choices. How do we pick that next step to help us get more coverage? And that's why we take a look at this map here. And if we stay with original Medicare, where I can go to any doctor, any hospital in the United States accepts Medicare, then I need to pick up a Medicare supplement. Now, a Medicare supplement is a private insurance plan. It is not Medicare. It supplements original Medicare in A and B. And we'll also have to add a Medicare Part D plan. Again, private insurance company, but it is Medicare. And that gives us complete coverage, A, B, and D with a supplement. Or we can take another option, and that is called Part C, Medicare Advantage. Now, with Part C, what happens is Medicare, we still pay that Part B premium. Remember, it's coming out of our Social Security check, or we're writing a check every month. Medicare gives a lump sum of money to a private insurance company, and they tell that insurance company, you can now manage that Medicare, but you must still give them the same protections and the same benefits as we give them. So the insurance company comes forth and makes a plan based on A, hospital visits, B, doctors and outpatient, and D, drug coverage. So it combines all those benefits into one plan. Medicare supplements, again, this is used with original Medicare. Private insurance plan has plans A through N. And you can see by the graphic here that each plan covers certain things or doesn't cover certain things. So if I am age 65 after June 1st, 2020, I can no longer get a Plan F. So the most comprehensive plan is a Plan G, which will pick up 100% of what Medicare does not cover, except for that Part B deductible. And we'll get into that here in a second. Part C, again, Medicare Advantage. We're no longer using our Medicare card. They're filing directly with the insurance company as A, B, and D all in one plan. You must have Medicare A and B to enroll into a Medicare Advantage plan. It is issued by private insurance companies. So you see all that stuff on TV all the time. Different companies have different plans. And it's very important to understand that different companies have different plans. They're not all the same. You must continue to pay that Part B premium and penalties if appropriate. Plan premiums are typically zero, where a Medicare supplement and a standalone Part D plan have a monthly premium. Medicare Advantage typically have zero premium. So you don't have that monthly premium, but you have a copay to go to the doctor. You have a copay to go to the hospital. But it also has a safety net, which means once you get to a certain money spent for the year, the plan will no longer charge you. In most cases, there's an HMO or a PPO. Now, again, you have to use networks. An HMO says that you must use that insurance company's network of providers. They are contracted. A PPO usually gives you in-network and out-of-network. So the PPO has in-network, you use those contracted providers and you pay less out of pocket, but you have the choice to go out of network and have a higher copay. Special needs plans may be available for Medicaid beneficiaries and also people with chronic illnesses. So if you have a heart condition, diabetes, things of that nature, you may want to check on that to see if there's a plan that's better suited for your condition. Now, providers submit bills to the insurance companies only. They do not file with Medicare. So you'll have a Medicare Advantage card. You'll take your Medicare card, put it into a safe place, but they will not be filing with Medicare. But Part C plans, Medicare Advantage plans, also provide more benefits that original Medicare don't provide. You also have a vision benefit, hearing benefit, dental, may have some dental benefits in there, a gym membership, over-the-counter products where you can actually get healthy things that can be very beneficial to you, plus more. So again, A, B, and D equals Part C. So at the end of the day, you've got two different choices. If we stay on the left side, we stay with original Medicare. No networks. I can go to any doctor, any hospital that accepts Medicare. But I must pick up a Medicare supplement to protect ourselves financially, and I pay a monthly premium. And I pick up a Part D plan for my prescription drugs, whether I take any medications or not, or will suffer a penalty. I pay a premium for that plan while I take in medications. So I like to call this pay now because I'm paying premiums whether I use it or not. That's option one. Option two is Medicare Advantage, where now I have a Medicare Advantage card. I don't have 3 cards I carry into my wallet. I have a Medicare Advantage card. The doctor, the hospital, the prescription drugs all file directly with the insurance company. Again, these plans are typically zero premium. You still pay that Part B. You still got to pay Medicare. But I don't pay anything unless I what? I call it pay later unless I use it. If I go to the doctor, I have a copay. Go to the hospital, I have a copay. But I have the same protections as original Medicare. So when it comes down to understanding my Medicare choices, it's about what's best for one person versus another. So you may have one spouse, the original Medicare is probably the best thing for them. And you may have the other spouse, well, Medicare Advantage might be the best thing for them. So let's take another look at Medicare supplement working with original Medicare versus Medicare Advantage. Doctors and hospitals under a Medicare and supplement insurance plan, you can select doctors and hospitals as long as they accept Medicare. On Medicare Advantage, you may be required to use doctors and hospitals in that plan. Okay. So again, that's only if it's an HMO. PPO allows you a lot more flexibility. Referrals. You do not need a referral with original Medicare. You can see a specialist without referrals. Under Medicare Advantage, you may need to get referrals and may be required to use network specialists. Again, depending on whether or not it's an HMO or a PPO. Network. Under a supplement and original Medicare, there are no restrictions. The coverage goes with you across the United States. Medicare Advantage, you may have network restrictions. Emergency care is covered throughout the United States and sometimes abroad. Now, we understand Medicare is security financial management. We also have insurance carriers that we can recommend based on your situation. Enrolling, you can buy a Medicare supplement plan anytime after you turn 65 and join Medicare Part B. So again, if I am working and I am 65 and I take Part A and I'm going to delay Part B until when I stop working because I have my insurance through my employer, then I don't need Part B and I don't need a supplement. And again, now we're looking at Medicare Advantage, it'd be the same situation. And a lot of times we have clients come in and say, do I stay on my employer plan or do I go full Medicare and go with one of these options? That's really going to be an individual situation in which we can help you, guide you through what is best for you based on a number of factors. Then you have costs. Again, with original Medicare and with that supplement, you pay a monthly premium in addition to your Part B premium. When you use services, your out-of-pocket costs are limited. With Medicare Advantage, you generally have a pay a low or zero monthly plan premium. We've talked about that in addition to your Part B premium. When you use services, you have copays, coinsurances, deductibles, and then prescription drugs. With a Medicare supplement, it does not cover Part D. You need a separate Part D prescription drug plan. With Medicare Advantage, it is included in most plans. So things to consider individually. One is your health situation. You know your health. You know what you currently are. You know what your health history is. Your financial situation. Can you afford a supplement? How do all these things factor in? Your medical history. If somebody has previously had cancer in a short period of time, or if they've had a heart condition, we take a look at those things to help guide you into the best way for you to receive those benefits. And I think this is the biggest thing is people tend to, in our experience, tend to gravitate to something without understanding the big picture. And that's what gets people in trouble. But also your need to access doctors and facilities. Again, based on your individual situation, you may need a little bit more guidance to understand how each option would particularly fit for what you want to access for your healthcare. And we're here to help you not only today, but every year. Again, you have the annual election period. You're going to have the same questions. Do I stay on this plan? Is there something? We are here to help you. And if any of you have any questions, you can reach me again. My name is Dan LaForest at 407-644-4686, or you can email me, dan@sfmadvisorgroup.com. And we appreciate you staying with us today. And hopefully you learned a little bit more about that complicated Medicare maze.